So today I'm going to be talking to you about 5 major sleeping disorders that affect Americans and really people all over the world every day. The first is one that you heard about quite a bit in the Sleepless in America documentary, and that is insomnia. And insomnia is really just defined as persistent problems falling asleep, and it affects about 10% of the population. And there's 2 different types of insomnia. Primary insomnia is insomnia that's not related to any medical, psychological, or physical condition. So in the United States, National Sleep Foundation 2008 Sleep in America poll, 65% of respondents reported that within the past year they had experienced a sleep problem at least a few nights a week. And 44% said that they had experienced at least one symptom every night or almost every night. So common symptoms of insomnia include waking up and feeling unrefreshed, and that was about 49% of the people that responded, and being awake a lot during the night, and about 42% of respondents said that they had experienced that. Less frequently reported symptoms are difficulty falling asleep, that's about 26%, and then waking up too early and not being able to get back to sleep was only about 29%. Some researchers attribute the increasing problem with insomnia to the aging of the U.S. population and to the growing demands that have been placed on people. As the larger baby boomer generation gets older, sleeping problems are likely going to continue to rise. As for stress and work, about 25% of adults believe that they cannot be successful and get enough sleep. And about 7% of those with insomnia never tell their doctors. Chronic insomnia is when insomnia occurs most nights for 3 to 4 weeks, and that's what makes it considered chronic. Chronic anxiety, depression, situational stress, and stimulus overload are among the important psychological causes of insomnia, and that counts for about 50% of all cases. Drugs, including caffeine, alcohol, and nicotine, account for another 10% of all cases. Decongestants, as well as drugs prescribed for asthma and emphysema, may also keep people awake. Medical problems lie behind about another 10% of all cases. People who have narcolepsy, and this is also known as having sleep attacks, often suffer from sleeplessness and may fall asleep at unpredictable or inappropriate times, and it can be unpredictable and inappropriate. It is when people suffer from a sleep attack related to narcolepsy, they go directly into REM sleep, and this sleep disorder is actually pretty rare. Less than 0.001% of the population. Some symptoms include being sleepy all the time, and often people with narcolepsy fall asleep without realizing it. Typically, its victims do not realize their sleepiness as a sign of the disease and then don't consult a physician, and they might not be diagnosed until a full 10 to 15 years after their symptoms first appear. A physician, William Dement, reported the case of a woman with narcolepsy who once fell asleep 20 feet underwater while scuba diving, and another of a fireman who had an attack while climbing a ladder into a burning building. So this sleep attacks can happen at any time, and there's not necessarily a rhyme or a reason to it. The most dramatic component of narcolepsy is cataplexy, which is attacks of muscle weakness or near total paralysis. Sleep attacks are often triggered by the intense emotion associated with stress, laughter, anger, or surprise. And sometimes when the sleep attack happens, victims can also experience cataplexy. So not only do they fall asleep directly into REM sleep, but then they also lose all muscle tone and may sometimes just drop. Another common sleep disorder is night terrors. And Night terrors, and then the next sleep disorder that I'm going to talk about, sleepwalking, occur primarily in children, and it typically appears by the time people reach adolescence. However, they can continue into adulthood. Parents who worry about the psychological significance of the episodes probably suffer more than their children, who typically wake up the next morning pretty much unaware of anything unusual has happened. So what exactly is a night terror? For one thing, it is not a nightmare. And generally, night terrors are characterized by a person waking up and screaming and having no idea why. Nightmares, the reason why these are not nightmares is because nightmares are scary dreams that occur during REM sleep, and they scare the sleeper, who usually wakes up from the movie-like dream and then have a vivid memory of the nightmare. Night terrors occur in stage 3 or 4 when you are in your deepest sleep, and they can last anywhere from 5 to 25 minutes, and they involve blood-curdling screaming, sweating, confusion, rapid heart rates. The person may run around the room while screaming. They may have their eyes open, but when they wake up in the morning, usually they have no memory whatsoever of these night terrors. Laboratory studies have indicated that these episodes do occur in the first deep stage sleep of the night, and they're generally associated with body movements and intense autonomic activation. Brainwave recordings that have been done indicate that both sleepwalkers and night terror victims are passing back and forth rapidly between sleep and wakefulness. And sleepwalking often occurs when people are very sleep deprived. And sleepwalking is our next sleep disorder. It is a disorder in which a person is partly but not completely awake during the night. That person may walk or do other things without memory of doing it. Like I said before, sleepwalking is a disorder that's associated with children, although some adults may sleepwalk. Most children who sleepwalk do not have emotional problems and will outgrow it. Sleepwalking has also been linked to stress, fatigue, and the use by adults of sedative medicines. Sleepwalking can also be inherited. Contrary to myth, it is not dangerous to wake up a sleepwalker. However, because sleepwalkers are not fully conscious, they will be disoriented if you wake them up. Just like night terrors, laboratory studies have indicated that these episodes occur in the first deep stage sleep of the night and are generally associated with body movements. Brainwave recordings indicate that sleepwalkers are passing back and forth rapidly between sleep and wakefulness, just like night terrors, and it often occurs when people are very sleep deprived. These type of non-REM sleep disorders, like somnambulism, sleepwalking, and night terrors, tend to run in families. One patient claimed that everyone in his family was a sleepwalker, and he recounted a story of a family reunion at Christmas time in which he found himself surrounded by all of his sleeping relatives in his grandfather's dining room. And like I said before with night terrors, this is most often happening in children, so they're more likely to sleepwalk if they're also experiencing night terrors. Our final sleep disorder is sleep apnea, and you also got a little bit of information about sleep apnea in the Sleepless in America documentary. And sleep apnea is characterized by a person stopping breathing during their sleep. They tend to wake up momentarily, and that wake up is characterized by gasping for air, and then they fall back asleep. Generally, people who are having those apneic episodes are not realizing that they're having them. Sleep apnea is becoming more and more common, especially as people gain weight, and heavy males tend to be the most susceptible to sleep apnea. And sleep apnea, because it cuts off oxygen to the brain, it can be fatal. It can cause high blood pressure, heart attacks, stroke. So sleep apnea is a very, very serious sleep disorder that needs to be treated. So if you ever hear anybody waking up gasping for air, you need to tell them to go see a doctor immediately. So apnea literally means cessation of respiration. In an apnea, they change from a wakefulness to sleep. It causes our central nervous system to actually stop functioning. There's two different forms of sleep apnea, central sleep apnea and upper airway sleep apnea. Central sleep apnea is after the individual falls asleep, the diaphragm stops moving because the brain is no longer sending impulses to control it. And then the more common form of sleep apnea is the upper airway sleep apnea, where breathing is blocked by a loss of muscle tone in the tongue, throat, and larynx. That is characterized by intermittent loud snoring. And so if you know somebody who's a really loud snorer, then there is a possibility that they're also having apneas. In addition, elevated blood pressure may occur that places additional strain on the heart. After about 60 to 100 seconds of sleep, the person awakens and then takes a series of kind of gasping or choking breaths. As a rule, these arousals will only last a few seconds as the blood gases quickly normalize and the person returns to sleep. Like I said, they don't usually even remember it. The cycle repeats itself throughout the night. Some patients have woken up as many as 500 times, but might be so habituated to their disorder that they're completely unaware of any of those. They could be completely oblivious to the fact that they can't breathe and sleep at the same time. Others don't return to sleep immediately after the apnea and then complain of insomnia. There is a really effective treatment. A nasal CPAP, or a continuous positive airway pressure system, has proven really successful with many victims. A fan actually provides a stream of air through a small plastic mask that's worn over the nose and sometimes mouth during sleep. And patients sleep with that mask over their face, and there's usually a strap that goes around their head, and this forced air opens that constriction in the throat and allows a normal flow of oxygen into the lungs.